Hello everyone and welcome back to our channel Quaint. Today we will talk about a condition that often gets overlooked but deeply affects the patients and their families, encephalopathy. And we will decode the idea of brain fog through a nurse's compassionate lens, where science meets empathy and where care is not just about treatment, but where care is about healing with heart. Anyway, so what is encephalopathy? Encephalopathy, this is not just a single disease. Okay, encephalopathy is not a single disease. It's actually an umbrella term for brain dysfunction caused by many possible factors such as liver failures, then what? Kidney problems, lack of oxygen, toxins, and even metabolic imbalances. So many possible factors are there for encephalopathy. And brain fog, this term is actually used by laypersons. Okay, and the term encephalopathy, that is a medical term. That means the term encephalopathy is used by doctors and nurses. Brain fog, this is used by laypersons. So patients often describe their experience as brain fog. That means confusion, forgetfulness, difficulty focusing, or even changes in personality. So from the medical perspective, okay, this is what? It's the condition where the brain is actually struggling to function properly. From medical perspective, this is encephalopathy. Brain is struggling to function properly. But from a human perspective, it can be frightening and isolating. And here, nurses play their vital roles in decoding the subtle signs. And it starts with their careful observation. They minutely observe many things such as speech, alertness, behavior. Means nurses actually observe the patients carefully. They observe all these things. Behavior of the patients, their alertness, their speech, all these things. And actually, just for example, say for example, a patient all of a sudden starts feeling drowsy. Okay, so, or irritable. Okay, in that case, it may be this thing, this drowsiness. Okay, this may be early signs of encephalopathy. But just recognizing the disease, that is not the task of nurses. Means their care actually does not stop at just recognition. But after recognition, what they actually do? The nurses actually, after recognizing the disease, they actually talk to the patients and their families, explain to them in simple terms the meaning of brain fog. Okay, in simple terms, because all the people are not able to understand the medical terms or the medical description, medical analysis of the disease encephalopathy. So in simple terms, nurses actually describe the problem to the patient and to the patient party, means their families. They actually, after doing this thing, they create an environment of safety and calm around the patient. Means from this point, after recognizing the disease, actually their actual care starts. And it is more than medical treatment. You can easily understand. Yes, they maintain the protocols, such as they actually ensure hydration and nutrition of the patient. They prevent many problems like falls or infections. Means they actually prevent complications like falls or infections. They closely collaborate with the doctors to adjust treatments or medications. So they do all these things, but this protocol is not enough. These are well documented protocols followed by nurses. But beyond this, what is the most important thing, means what actually truly matters, that is their empathy, their compassion. Actually, encephalopathy strip away a patient's what? Clarity. But nurses help preserve their dignity. Help preserve the dignity. Holding a hand, speaking calmly, or just being present reduce the anxiety of the patients, as well as it promotes the trust of the patients. So you can see that this treatment or this care of nurses, okay, this is not just clinical. This is actually human, and this human touch is actually more than the clinical results. Clinical results means, I want to say that the treatment procedure. Actually, doctors do what? They prescribe medications, and certain protocols are there. They also instruct their nurses to do all those things. But in spite of all these things, if the nurse is not compassionate about their patients, then these things won't happen at all. Okay, if their mind is compassionate, if they take care of their patients compassionately, means with their hearts, in that case, that makes the biggest difference in recovery. And I think this is already known to everyone. So that's why they are very important in the field of healthcare. Their compassion makes a lot of difference in healing, in recovery of the patients. Anyway, so this was all about today's topic, okay? And if you found this video interesting, so please like, share and subscribe to our channel. This is the end. Thanks for watching.